Coffee with the Candidates, folks. This is your chance to hear from all of the representatives that are trying to get involved in this race and everything that they're trying to do to serve you and serve this community of Klamath Falls and Klamath County. And we are part of a very big district. And as accordingly, we have 6 Democratic candidates running for the office against Cliff Bentz. The first one who we're going to have today is Rebecca Mueller, and I left her off the list last time, and that was my mistake. I shouldn't have done so. I feel I mea culpa, maxima culpa. I have screwed up, and I didn't mean to do that. But Chris Beck is also in this race. Mary Doyle, Peter Quince, Dawn Rasmussen, and Patty Snow are all in this race. And the reason why I left her off this list is because I didn't get her to see her speak at the Democratic dinner the other night. And so today we're going to fix everything and we're going to introduce you to her. And without further ado, please let me introduce you to Rebecca Mueller. How are you doing today, Rebecca?
I'm great. I'm really glad to be here. Thanks for adding me on.
Well, I am so sorry we left you off the list on the last episodes that we did, but yeah, that's how it
No
goes.
problem.
I
Yep,
apologize for that profusely.
we're all good.
So tell me, what is it that got you into this race? What is your driving mission to take over Cliff Bentz's role in this county? Because he's kind of Johnny come lately in a lot of ways. He's not doing a lot to talk to the people of this county, and they're upset about that, I think.
Yes. So really it's two things. It's my experience for one and broken government is the second. So my experience really is two parts. One, I'm a pediatrician. I've worked in rural healthcare for 15 years. And that means that I've had a lot of experience talking to folks that don't agree with a lot of standard pediatric practices that are definitely supported in, a Democrat-leaning community, things like taking a sexual history from a teenager, things like vaccinations, and when we were having our COVID policies. And because I work in a rural area, I had to develop a way to build trust and rapport and collaborate with my families who often were not comfortable initially with all of those things. So, you go into practice, and at first my thought was, well, I'm going to convince them otherwise. And very quickly learned that I could do one or the other. I could build trust without an agenda, or I could have an agenda and see patients that I cared about, that I wanted to have returning for care, have a contentious relationship with their healthcare provider. And so I opted for the first one. I opted to prioritize trust and not prioritize my own thoughts about what the right steps were. And in working with our rural constituents, that seems an important thing. The only other thing I'll mention about that is at the same time, working in rural environments, a lot of my patients are on Medicaid. A lot of them are working 2 and 3 jobs. They may not have benefits. And in that 15-year career, I've seen things get harder and harder for families. Families feel more and more shame, feeling like the fabric of our American families is just being, pressured, and it's fraying at the edges or fraying in the middle. And in the meantime, a broken government hasn't solved any of the issues. So just on that second point of broken government, I've heard the same speeches from candidate after candidate after candidate. We've looked at the Facebook reels. We've heard all the, the political pundits have their favorite things they like to say, and it all makes sense when I'm hearing it. And yet when I look at what's going on in our government, I'm not seeing progress. And so it was really that misfit of things getting harder for families, the government working less and less for the families, and me being in this position, this unique position of being able to find common ground, middle ground, and really build trust in a community that's so vulnerable. So that's why I'm running.
Well, congratulations on entering the race, and
Thank you.
congratulations. And I'm so sorry I didn't mention you the last time. I
That's all right.
apologize for that. But so tell me, I mean, what is it that is driving you to want to get into this melee? I mean, this is, yeah, I mean, there's not a lot of people that like each other in Washington these days, and
Yeah.
you're wanting to head out there. So what is it appealing? What is appealing about that to you?
Um, you know, I think it's partially the fact that When I am talking with my patients and we're making those, we're bridging those gaps and we're making plans and we're coming up with the common ground, as my perspective has changed, as I'm growing in my understanding of the experience of others and making those priorities, um, I that is a really inspiring thing to me. And when the government is this broken, it puts so much more pressure on the institutions. It puts so much more pressure on the community schools. It puts so much more pressure on the healthcare systems. But I hate to break it to you, our healthcare systems are just as broken as our government. No big surprise. And so, I've tried. I had 4 years of being in healthcare leadership. But the fact of the matter is, when our healthcare dollars are largely going to enrich corporations, health insurance companies, pharmaceutical companies, hospital systems, and not going to actual patient care, that broken system affects everything we do. And so the idea of sitting it out because they don't like conflict. I actually don't like conflict, but that's partially because I'm the person that they send in to the conflict. I've been the person that on the peer review committee at the hospital. And if they have a doctor that they're having a hard time with, they send me in there because I'm really good at sitting down with someone that seems to have, be at odds in terms of what they're wanting and what we're wanting. And I can sit down and I can show that I understand their position and provide some insight into our position and kind of smooth things out. Same thing goes for patients. We have an irate patient that's not getting their needs met and they're getting frustrated. I'm the doctor that goes in and says, "Hey, talk to me. What is it that's making you feel so over the edge today, and how can we deal with that? How can we come up with a solution in the long term?" So again, it's that experience of building trust and collaboration and feeling like I can do more with those skills. I can take my very close, I'm not from a bird's eye view. I am not only in the trenches medically speaking, but with families that don't know what to do because they can't find quality health care, or with families that don't know what to do because their special needs child keeps getting out of school and they keep having to take off work and now they're going to lose their job. These are very crushing issues on the individual level that I am constantly in. And I want to take that deep insider knowledge and my problem solving background to a place that seems to have lost the ability to collaborate and seems to have lost the focus on who these policies are supposed to be serving. So it makes sense to me. The math adds up.
Well, that's perfect. That was a very succinct answer, actually. Thank you so much.
Okay. Yeah.
So tell me, I mean, you come from a healthcare background.
Mhm.
As a representative of Congress, what do you think you can do to make healthcare more affordable, to make healthcare more available? What can you do to ensure that the average American gets the healthcare that they need and gets the things that they need?
Yeah. So the wonderful thing is we actually don't need to invent the wheel. We have the examples of 30 plus other countries that have universal healthcare systems, some of them with single party payers, some of them with an actual public health system. And we've got a broad scope of examples out there from countries who are making sure that every single one of their citizens and even their residents has healthcare provided for them. So the beautiful thing is, I don't have to come up with, an amazing plan all of my own. However, I do find in terms of healthcare specifically, my goal is that we would be a Medicare-for-All system, and we would have not only universal healthcare, which means universal healthcare, just to make sure your listeners understand the difference, means everyone has healthcare that is paid for in some way. So you don't have anybody out there that's uninsured or underinsured. Everybody has access to care. Single payer system means that the government takes over as the payer rather than private insurance companies. So just like the government right now Medicaid is paid for with a combination. Actually, the hospitals pay into Medicaid, the hospitals and providers. The states pay into Medicaid, and the federal government pays into Medicaid. So you can have a system that's combination of folks putting into the pot, or like Medicare. Most of Medicare care is paid for by the federal government, and then you have your Medicare Advantage plans that are actually paid for by the recipients of the care into the insurance companies. So, there's different ways we can do it. We can even look at the models within our own health system. One thing, I do actually have a 3-step plan on how to get us to a single payer system, which I think would be the best for us to get to. And the first step is actually to get to a portable health plan system. What that means is that everyone that's paying into a private insurance plan, most of them are getting it through their employer. About 20 million Americans are on the ACA marketplace system. So those 20 million Americans, instead of their employer telling them, we're contracting through Regence Blue Cross this year, we're contracting through United Healthcare. Instead of the employer saying that, those 20 million Americans on ACA Marketplace go in, they find the plan that works best for them and covers their preferred doctors and healthcare systems. So if they have, a chronic medical condition, they aren't at the whims of their employer, who changes their plans every year, and then they have to find a new doctor. And so we could do the same thing for employed folks, where instead of their employer dictating the terms and provider of their health insurance plan, those employers could actually pay the premiums, but basically pay into a credit that then is recorded on that ACA marketplace, and it would allow all Americans that are relying on private insurance, which I think is something like another 120 Americans, but then they could go on those same marketplaces and find the plan that works best for them. So we basically just amp that up. Now, that still puts a lot of money into the self-enriching pockets of private health insurance plans. And I don't think Americans, when they are paying, thousands of dollars in premiums a year, or their employers are paying thousands of dollars of premiums a year, I don't think their dream is that all those dollars go to building, high rises in big cities and supporting sports teams, right? So we want our healthcare dollars to actually support our health, not health insurance, shareholders. So eventually we do need to get to a single payer system. And one of the ways we can do that is actually offer a public option on the ACA marketplace. And that can be done state by state. So Oregon, for example, is working very hard to get us on a Medicare-for-All insurance system. And one of the ways they could step into that is actually provide a health insurance plan that's paid for, just like a private insurance. But instead of that money going to Aetna or Regence Blue Cross Blue Shield, the employer actually pays the state to be the holder of that money and pay for the insurance plans. One of the beautiful things about that is that the state doesn't have to come up with the money for the insurance that they're providing. They are actually getting the money from the employer and the individual, just like the private insurance plans are. It's just the state is not going to be building high rises and sponsoring sport teams, right? So the actual amount of money that's going towards healthcare will be more, because the state also has a more vested interest in their population maintaining health and not being stuck in a lurch. And actually, people complain all the time about government bureaucracy and inefficiencies, but the government generally is much more efficient in actually providing healthcare to the members of those health plans that are supported by the government than private insurance companies are. So that also provides some incentives to the private insurance companies to make their plans more competitive and not be so self-enriching. So that's step 2. Step 3 is then to also look at the federal government. And if we have multiple states that provide a public option, then the federal government can kind of look at best practices and then do the same thing. And they can do that by expanding Medicare options. A lot of people have talked about expanding Medicare down to 55. I actually advocate for an opposite plan, which I hesitate to talk about because most voters are people that are 30 and up. But a more cost-effective plan that actually gets the insurance to the people that are the most uninsured or the least insured is by doing a Medicare plan or Medicare type plan for people that are 25 to 35. So right now you can stay in your parents' plan until you're 25. And a lot of young adults don't have full-time jobs and they don't have jobs with benefits. And it is a major strain on our young adults. And if you think about when are you going to be having babies and when are you going to be making these decisions, and a lot of young professionals don't have full health insurance. And so who wants to have those risks of making those types of decisions? So they stay uninsured or they have to take a crappy job with benefits that doesn't allow for them to actually invest in their career. So by the state actually covering those folks, the cost to cover 25 to 35-year-olds is actually crazy small because their health is generally good. And by doing that, we then are covering the least insured people, and then we step it up. So then every 5 years, we take on another 10-year age bracket. And so it only takes a couple of step ups. And then we've got the whole population covered. So that's kind of my 3-step plan. And in the meantime, all of those state plans, if they're run well, people will want to opt into those plans, and we get better and better. And the other advantage of doing kind of a stepwise version is we could end up like Switzerland or some of the other countries that have a combo. So you could have state, public run plans and also have private insurance plans, and they can both be there in the marketplace and people can have the full choices. But it doesn't work if we don't have public options, because then the folks, the 5 big health insurance industries get to set the precedent for how much care they're providing versus self-enrichment they're providing. And that does not work well for the American public.
Well, I have to ask this question, and
Sure,
I think you have a very
absolutely.
cogent, very well thought out plan, and I don't want to in any way, shape, or form imbue your plan with anything other than what you've just said.
Sure.
But I do know the predominant part of your district, if you win in this district, doesn't like paying taxes very much at all.
Yeah,
And they are very, very Republican, and they are very, very against the idea of paying a lot of taxes.
I
And if
agree.
you take places like Canada and you take places like England, you take places that have socialized medicine, they pay a little bit more in taxes, don't they?
They do. They do.
So how are we working away? How are we working around that?
Okay, so there's a couple of things. So one is, as I mentioned, if we just get to where there's a public administered option on a private insurance type basis where the individual and the employer are paying in, I think we will still get better quality, better coverage, and less self-enrichment of health insurance industry, where more of the money is put towards care and less of the money is put towards, somebody's private jet. So that's still a win, and that would actually not require more taxes, right? So the state is just another player on the health insurance, just like they are in Medicaid, right? They negotiate their own rates, they facilitate all sorts of things, but then they could do it at a higher compensation level to actually be able to compete with private markets. And they could do that as well because they're actually getting the money from employers and employees, just like the private insurances companies are. So there is that option out there that does not require increased taxes. The other thing I just want to note, shameless plug here, I actually did about a 20-minute talk about my understanding and renewed perspective about rural populations, resentment of taxation.
Sure.
And I talked about how when I was driving around in rural Oregon, out in towards Enterprise, Oregon, there's a lot of signs up, Ed deal, no tax, right? And as you're driving, you're seeing tons of ranches, tons of cattle, small communities. And it just made me think, how visible are the state's investment in this community? Because one thing that we know about rural America is that they rely on themselves for a lot, right? Like
Yes.
they're doing a lot of their own things and they're just making it work. And, a farmer is not just a farmer. He's also a mechanic. He's also going to be the coach for the team. There are all sorts of hats that they wear in rural America. And that is also true in the community and how the economy runs. And so I just wonder how visible the state's investment is in rural communities, because I can tell you that if I was barely making ends meet, but I was paying thousands of dollars in taxes to my state, and I did not feel the tangible benefit of that coming back to me, I would be pretty resentful.
And that's
And
exactly what's happening here in Eastern
yes,
Oregon because
yes,
there's
of
a
course
lot
it
of
is.
people that, I mean, they don't like the county government. They don't like the city governments. They don't
Uh-huh.
like the federal government. They don't like the state government. They don't
Well,
like any government.
they do like the city and the county a lot more, though. And why? Because they can see that the city is using money to pay for their water. They can see that the city is using their money to figure out the electricity, right? And they know that they rely on those systems. Now, not everybody, because some people have their own private sump pumps and things like that. But when you see the government working for you, you are a lot less resentful about paying into it. They know that their kids are going to school and they want that teacher who's also, their kid's piano teacher. They go to church with them, right? You know, they want that person to continue work in their communities. They're not resentful that that teacher has benefits, yada, yada. They see the municipal hospital, while Wallowa County has a municipal hospital there, or sorry, not municipal, a county hospital. And so they see that benefit. And so they're less resentful of their local governments because they can see what they're doing. When they send money to the state, they feel like they're just waving goodbye to it,
Yeah.
right?
Yeah.
And the federal government is the same thing. Now, the federal government does do some pretty huge payouts. And when I was looking into this, and like I said, I do have this on my, so we don't have to talk about it too much and people can just go to that and then I can talk about something else. But one of the things is when you compare how much money is coming back to rural communities, the federal government includes all the money going towards public lands. As you and I both know, rural folks have a very conflicting view about public lands
Sure. Sure.
because
Yeah.
public lands are lands that are not taxed by the local community. The county can't tax that. So you have a huge county. They have to provide services in and around those public lands, but they aren't able to tax those lands, which is why the Secure Rural Schools Act is so important in terms of the federal government. And we can talk about that. But when you include public lands in your calculation for how much money is coming back to rural America, very little of that money is affecting the local economy in these small towns in these counties. Now, of course, if you are by a state park and you have a big recreation area, there's some effect on your economy, but it's not helping the local people, invest in restaurants, infrastructure. What would be transformational for that is getting the agricultural monopolies away and these consolidated farms away. So we actually have small family farms, which means a higher number of population in these towns, which means that we suddenly have, the critical mass to support local business and to get back to a thriving rural economy. We can also talk about, banks are pulling out left and right. There's not nearly the same number of local branches. 48% of local branches in rural communities have closed. And that means they don't have access to local capital and those close banking relationships, which are required when you're, putting out some risk of taking on small business loans. But all of that is to say there's major needs of investment. There's major needs for resources in rural communities. And when we say, well, they get tons of money and we're lumping that in with public lands, I'm not sure that that's a fair assessment. And when you take that out, they are severely under resourced from their own taxes. And yeah, that breeds resentment. The last thing I'll say about that is I think it's very parallel to what a lot of Democrats get angry about because we feel very acutely the fact that billionaires are taking away all the money from working class Americans. They're making it rich, but they're not applying those riches. They're not giving that wealth back to the folks that are helping them build it. The workers on the factory floor or in the Amazon delivery area, they're the ones that are actually doing all this work to build profit, but the people at the top are pulling all the profit away.
Sure.
And I feel that we have a lot of anger as Democrats at all of that money leaving the hands of working people who have worked hard for it. And I think in a very parallel way, rural communities feel the same way towards the government. It's their blood, sweat, and tears that is keeping the land, available for agriculture, they're fighting wearing all those different hats that we already talked about to keep those rural communities thriving. And they're paying into a system with their blood, sweat, and tears. And then the state's demanding more. Now the 6% gas tax, right? State's demanding more, and it's siphoning money away from those rural communities, just like we view the siphoning away of money through all these, billionaire priorities. So
Well,
it's
as
very
you know,
parallel.
this is going out to Klamath County. And Klamath County, we have 740, 760 people in Chiloquin. I mean, we don't have big communities here in Klamath County.
Yeah.
We're not what you'd call a thriving place with lots and lots of people. So, what would you say to somebody that lives in Gilcrest or somebody that lives out in Sprague River or somebody that lives out in Chiloquin that, they are just as confused about all this stuff as I am or as anybody else is.
Mhm.
How can you reach out to those folks?
Yeah. So honestly, I think the first step is entering the room, not assuming that I have all the knowledge or that I know that I'm right.
Hmm.
Just like when I was driving through those communities with eyes open for a new perspective, and I was like, I'm seeing some things here. Just like with my patients, when I walk in the room and they say, we don't want anything to do with vaccines. And instead of saying, well, I'm not the doctor for you, or I make a comment about, oh, you must want to murder your children, which literally some doctors will do, instead I say, okay, if you're comfortable telling me more about that, I'd love to hear it.
Sure.
And so, similarly, when I walk into a room and the folks are upset because, oh, I'm just another person running for government and they hate government, I sit down and I say, tell me more about that.
Mm.
Tell me what you wish you were receiving from government. Tell me, tell me why you are concerned that government might pay for healthcare. What about that makes you feel threatened, or what about that makes you feel concerned? And we just start there. And I feel like we've gotten into, and this is my campaign really is about how, a lot of people talk about corruption in government and it's a problem, but when you look at what's actually going on in elections, I believe that we have hyper partisan politics that keep us from actually being able to solve real problems. And we're so hyper partisan that we can't even go into a room and say, I'm going to learn something today.
Sure. Yeah.
I'm going to have my perspective change today. And it's I don't know. For me, there's honestly like almost like a physical brain sensation when I'm like, oh, aha, I just learned something.
Well,
I just
I've
had my
said
eyes
this
open.
before. I think 80% of the people that live in Klamath, well, live in
Uh-huh.
live in the county or live in this district, they just want to pay their mortgage, send their kids to school, and come home at night. And that's all they really care about. They don't care about partisan politics. They're
Yeah.
not primarily concerned with, whether the Republicans or the Democrats are doing anything. They just want to live their lives and be normal people.
Uh-huh. And
And
I would say that part of the problem is that the billionaires and the people in power purposely are keeping us under the grindstone in terms of barely being able to make ends meet, that our immediate needs are all most of us can think about. And the
sure,
number of folks in our population that are having to focus on immediate needs is growing. We used to have a really healthy middle class that had a couple months put away that could think about taking a vacation without scrimping and saving, scrimping and saving. And we don't have that anymore.
yeah,
Most families are like, okay, I'm either going to go into credit card debt or my kids can't do any extracurriculars or we're not going on vacation. And those are our options. And then even worse, I mean, that's middle class, right? Even worse, we have folks that are like, I might have to bring in a stranger to sublet a room in the garage because we can't pay the month to month in our mobile home because our site, I forget what the land rates, that we're paying the land use rent has gone up astronomically. People talk about mortgage rates going up. They aren't even aware of how high the rates have gone up for folks that have a mobile home on land they don't own. And
Yeah.
how predatory is that, right? Because where are they going to move that to?
Well, even rental prices are going through the
Yes,
roof
no,
now,
rental
too. I
prices.
mean, rent, mortgages, I mean, just the
Yeah.
cost of running a
So,
household is so much more expensive than it
yeah.
once was.
So, how are you going to pay attention to politics? And honestly, this also plays into one other concept that I think is vitally important. So, a lot of us on the left come from social services careers. We might be teachers, we might be social workers, we might be nurses, we might be providers, whatever it is. And a lot of us have this training that talks about the Maslow's triangle. And Maslow's triangle basically is a way to say that until your critical needs are met, your day-to-day needs are met, you can't think about other issues. So, for example, when you're just trying to make sure that you can get to work and get your paycheck, the idea that your boss might be extorting you or might not be paying you fairly, or in a different way, that your boss isn't paying someone else fairly because they're a woman or because they have some other demographic classification that puts them at risk of making less money. You can't think about that because you need that paycheck. And if you don't have it, you won't be able to pay your rent that's due this week and it's actually overdue.
Yeah.
Right?
Yeah.
So if we keep folks in a constant state of instability, they cannot think beyond what they need to survive. And I think that's really important when we think about why Trump got reelected, because a lot of people want to focus on characterizations of their fellow Americans that are really deeply unflattering. And I try wherever I can to give grace that somebody may have a perspective that is different from mine. And I think understanding that there's a lot of people that what they remembered was they could pay their bills a little more easily last time Trump was in office. And they wanted to get back to that. And because of where they were on Maslow's triangle, they couldn't afford to think of all the other issues. And unfortunately, that's just continuing. When I've talked to folks that are not necessarily voters, but did what I call blind canvassing, where you're just blindly knocking on doors just to ask them, what do you think about our federal government? There were a fair number of people that are like, I don't know a thing about it. I don't pay attention to it.
Yeah.
And they are the people that are working night shift and then a second job during the day. And they're trying to do this, that, and the other and rent a space from somebody. They don't have time to think about it. But if we aren't careful, more and more of us are going to be in that situation. And unfortunately, we're going to permissively let this disarray in Washington grow and grow because we don't have the wherewithal to stop it.
Well, we're going to have to leave it at that
I
because we're running out of
know.
time for Zoom.
Yep.
But I want to thank you for being here today, and I want to thank
Yeah.
you for opening my eyes to the fact that you were running in this race, and that I
Yes.
apologize profusely that I didn't mention you in the last broadcast.
Sure.
But what I'd like to do is, if you're ever in Klamath County and you're ever wandering around this way, I would love to shake your hand and I would love to meet you.
Well, and I will just say that I'm going to be in the Klamath County Democrats meeting, which is next Tuesday, the 5th. Unfortunately, it's virtual because even though I'm full-time campaigning, I'm still full-time working as a pediatrician. And so that's why I also couldn't go to the last event that you were part of, but I will be there virtually in Klamath on May 5th during the Klamath County Democrats meeting. And so love to see people there and answer their questions.
Well, I am going to welcome you to that meeting, prematurely welcome you to that meeting because I may not be there in the meeting. I don't know if I'll be there or not. But thank you so much for being here today. And thank you for watching, because this is how we're going to find out, folks. This is how we're going to do what we need to do when it comes to primary season, when it comes to primary day, which is May 19th. It's coming right up. Tomorrow's May 1st. Wow. This season has just gone by, hasn't it? But if you're going to make it to this event, if you're going to vote in this election, these are the candidates you have to vote for. And Cliff Bentz is just not talking to us right now, folks. He's just not showing up to do pressers. He's not showing up to do events. And maybe we need to come up with a new person for that. But For Coffee with the Candidates, I'm Christopher German with the Sunshine News. Thank you so much for watching, and we will see you guys again next time.